This is Selma Schimmel for the Group Room at the ESMO 2012 Congress happening now in Vienna. Well, we are now joined by Professor Andrés Poveda, Head of Gynecologic Oncology at the Instituto Valenciano de Oncology in Spain. Welcome.
Thank you very much, Selma.
Tell us about the process of ovarian cancer and the challenges you face with relapse disease.
Well, ovarian cancer is a disease that in the first effort obtain a very high percentage of cure. So after surgery and chemotherapy, more than 80% of patients are free of disease. The problem is that most of patients will relapse. According to the platinum-free interval, the treatment should be adapted at each different situation. So the message is that at this moment we have more and more information thanks to the molecular biology to understand the different situation of the tumors and to try to give for each patient a specific treatment to help to obtain responses, right?
What are we learning via molecular pathology about pathways that are unique to ovarian cancer that could lead to more biologic and targeted therapies?
Right. The more promising, it's not promising, as is a reality, is angiogenesis. Angiogenesis is involved in more than 80% of the ovarian cancer. And we have already mature results for anti-angiogenic therapy, the bevacizumab. We have in front line 2 years ago. We have now also in relapse ovarian cancer patients in both platinum-sensitive and platinum-resistant ovarian patients. So this is the first step we have had achieved in molecular treatment for ovarian cancer. But we have more and more. So if we take a look to the last publication for the Atlas of the Gene in the human genome, the definition of the correlation between the molecular features and the classical histological diagnosis are more and more present. So that means that we can look each different subtype of tumor to give the different treatment, maybe in the near future, right?
Platinum-based therapy has been a standard in ovarian cancer. If you realize that a patient is resistant and not platinum sensitive, what would be the choice clinically, the options that are available for those patients?
Until now, we only have had drugs with poor responses and poor short progression-free intervals. However, the Aurelia trial we have presented last ASCO meeting, and here we have presented the analysis of the cohorts of different treatments. Aurelia showed impressive benefit adding bevacizumab to the standard drugs we were giving in this special fragile population. That means that at the moment, for instance, for patients receiving in the past weekly paclitaxel as monotherapy, the PFS was close to 4 months, and the results adding bevacizumab is longer than 10 months. That's more than double. That means that we have a very, very good news for this type of patients, and then we can offer her a better treatment without a specific toxicity.
There was some data in the last couple of years indicating that Doxil in women that are BRCA positive may be showing some unique benefit.
That's true. That is the result of our retrospective analysis, but we suppose that this is again a new finding for the molecular biology. So we know that for long-term survivors, there is a common, we say, BRCA-ness situation. That means that there is some alteration in the pathway to recover DNA. But on the other hand, we have specific treatments more and more for that situation. For instance, the PARP inhibitors. We have brilliant results with PARP inhibitors for the high-grade serous patients, and those patients are responding 1, 2, 3, and many times for platinum compounds. So the message is that the ongoing studies will give us enough information in the near future to help women more and more to be here, to stay here, with a good quality of life.
When you were speaking about relapsing disease, my understanding is that if a woman can relapse many times, but it is the interval, the period of time in ovarian cancer that's important, that if a woman can go a fairly long time before recurring, that's actually a positive thing. Can you explain a little bit about the meaning of the duration and time when relapse happens?
If the patient have a period of 6 or more than 6 months without relapse, that means that this patient is platinum sensitive. In other words, these patients have more possibilities to respond many times to different treatments. So there are many studies. We have also included some treatments with trabectedin and caelyx in partial platinum sensitive population. But the message is that in this population there are many treatments, many options. The message is to continue fighting because the possibility to obtain response again is really high. For patients with relapse before 6 months, named platinum resistant, the news are that we have now a new treatment, adding bevacizumab to the standard treatment. We are, for first time in the history, doubling the PFS, the progression-free survival. And not only that, we have a good, very good quality of life, because symptom benefit is really important, as you know. And we have also many ongoing studies in regards to this population with the help of molecular biology.
Professor Poveda, what do you think distinguishes some of the unique, maybe emotional, psychosocial, spiritual, existential issues for women with ovarian cancer than maybe some of the other cancers? Is there something that for you have seen a different psychology, a different issue?
I agree. I have in my team a psychologist that is working specifically for gynecological tumors. So I think that the consequences are not the same if you have a tumor in the lung, in the air, or into your gynecological area. So we know that.
I'm just curious. I mean, I'm sure depression may be higher, difficulty in relationships, marriages,
Yes,
intimacy.
Absolutely. One of the problems we are now working in is the sexual rehabilitation for the patient. So for many years, probably the main objective was to live. But I think that if you want to live with quality of life, you have to enjoy all the aspects of your life. And then the last incorporated in our experience was the sexual rehabilitation.
A woman's libido probably goes out the window in the middle of a treatment for ovarian cancer. How do How do you begin sexual rehabilitation?
The main part of the program is informative, and the second part of the program is to show, to teach them how to start to work in this type of activities.
I think it's really special that your center focuses on that as well. So you're telling me that you're treating the whole human being.
Yes.
Body, mind, and spirit. Thank you, Professor Andrés Poveda, Head of Gynecologic Oncology at the Instituto Valenciano de Oncology in Spain. Really appreciate the time you've spent with us.
Thank you, and the message is never give up.
That's the message.